So I want to welcome all that are here tonight. We also have quite a few followers that are following on Facebook and all the different Instagrams and all the different social media, so I want to welcome. We have offices in Florida, Lakewood, and Cleveland, Ohio. So hopefully we're going to have we have prepared questions, but hopefully we'll have active participation. We have Starbucks cards for those of you who, if I call your question out. And then also for people that are joining us on social media, if you use your question, you will also be able to get a Starbucks card. You can contact the Tree of Knowledge office, and we'll be happy to mail it to you. I welcome all of you. Dr. Tversky, in his book called The Spiritual Self, talks about the difference between human beings and animals. He said the two distinctive characters are character development and growth. He defines character development on social skills, and he defines growth on always wanting to learn no matter what we do and no matter how we fail. We as parents want to believe that we have some sort of control. And according to Dr. Tversky, that is a complete nonsense. We have no control. Children are born wanting to be two things: independent, okay, and they want to do their own thing. And it doesn't start in adolescence, which is what most people think. It actually starts at birth with feeding and sleeping, and the next thing is toilet training, and then the third thing, which we're going to focus on today, is school. The bottom line is kids want to eat and sleep when they want. They want to toilet train when they want, and they don't necessarily want to learn when they want. So knowing this, knowing that our children are striving for independence, knowing that it is our job as parents to help develop that character development social skills, where do we begin? And so tonight I have brought together a panel of experts that I currently work with in Tree of Knowledge, some for a very long time, some for a shorter time. Corey and I work together in speech therapy, but also a lot of behavioral and social skills development. Mrs. Gracco is here as a social worker here and also in some of the schools. Tehila Greenberger and I, we talked about this today, go back about 18 years as an OT. And I had an amazing, I still to this day talk about watching you in a trial where you testified, and I still learned so much from that about sensory integration that I use today. Vivian Garfunkel was one of my first tutors. She's an amazing special educator and a grandmother and a mother. And so we joined together humbly because at the end of the day, we don't know that much. We are all learning. We are all trying to develop. But our job is as much as possible to gain from other people who do know and to just put one foot in front of the other and constantly work so that our children can be the responsible, ethical adults that we truly want them to be. Okay? So we're going to start tonight with some of the prepared questions, but I'm hoping I'll get questions from the audience, and I'm hoping that we'll get questions from social media as well. Okay? So for the first question, my child gets so frustrated when doing homework. We're not going to discuss how we feel about homework. We're just going to go right into it, because research shows that for skills-based learning, they need to do some homework. He can't calm himself down and then can't complete his assignment. How can I help him express his feelings appropriately and self-regulate so he can successfully finish tasks? I'm going to address this question first to Corey and then to Mrs. Gracco.
So I think that a piece of this has to do with being able to organize and not get overwhelmed with what the assignment is, and can you break it down into smaller bits and pieces. Depending on what the child's strength is, some children may need to start with an easier task, an easier subject. And so if they're able to do that, they feel more confident, and then they're willing to continue on to other things. But really making it small and bite-sized pieces, and being there to help with information that they may not know. Vocabulary is a big piece of that, being able for them to understand what the language is in the assignments.
Go ahead.
Okay, so when I'm looking at, homework, what it's for is to help the kid, right, review everything they have learned during the day. Problem is when a kid's overly emotional, the logical and reasoning side of their brain that they need to do their homework is shutting off. So we need to kind of first help them is when they're overly emotional. Hey, it looks like you're kind of really frustrated right now. I think we need to take a little break. Or kind of distract them with taking a break on their own. Tell them a little story. If you're doing math, big subject that a lot of kids get very frustrated in, take out the chocolate chips. Hey, how about we do this with something a little more fun? You kind of have to help distract them, help them get less emotional so that they can start using the logical and the reasoning side of their brain. Another thing just to kind of keep in mind that if you see this as a pattern, that the kid is, constantly getting frustrated, talk to the teachers. Okay, there could be several reasons why the kid's getting frustrated, and sometimes the kid needs a little bit, sometimes the teacher can help and say, hey, instead of doing 10 examples, they could do 5 examples, still get the review, but before they get to the frustrated point. So, really kind of key is when they're frustrated, they can't work. So they might need that break, and they might need your help to help them notice that they need that break and help them kind of switch gears so they could think more logically to do their homework.
Okay. In research-based behavioral theory, we use the pre-med principle. First this, then this. So first we do some of the hard problems, then maybe we do some of the easy problems, or maybe we take breaks. So we have a simple concept that we can use. First you do this, then you get that. Okay, thank you. My child is completing C-level work, but is passing all of her classes. How do I know if she's reaching her fullest potential? Maybe a C is the most I can expect. How do I know if I have to raise that bar? How do I know if I should just accept the middle of the road? I think this is a complicated question. I'm going to let Vivian start.
One of the primary functions of education is the assessment part. So the first thing that I would do is have this child assessed. I mean, we don't have to take it to a psychologist or anything for a full level, but just to get a reading score on that child. So if we know that if the child could read, if the child can comprehend, that would be an indicator if he is doing if we're doing well in school. So that would be my first step, to actually see if he can do the work or if that's all he can do is see work. Now, if he can do the work and he's still getting C work, so then we get into the issue of motivation, and which we'll discuss later on how to motivate your child to do a work or whatever you feel that child can accomplish.
Okay, so I'm going to do a sample scenario. So we have a child who's having trouble copying from the board and is therefore bringing home incomplete papers to study from, leading to poor test scores and decreased self-esteem. I'm going to let Dahila Greenberg, the OT, talk about that.
Okay, so a lot of people don't realize that OTs work on these things, so I just want to give a brief, very brief overview of what OTs do, because a lot of people know about OT because of the big push for sensory right now, so behavioral, and a lot of people know about OTs in terms of fine motor, in terms of the handwriting and the cutting. But one of the things that we do work on is we work on visual motor, which is that coordination of being able to see something and being able to transfer it. And when you copy, it's a really complicated skill, because when you think about it, you have to be able to look up, retain what you're looking at, and retain it in memory and be able to transfer it to the paper. And it's in 2 different planes. What you're copying from is vertical, you're writing in horizontal. So one of the things that I would do is, and one other thing I should say is, it takes a while for that visual system to mature. So we actually don't expect kids to be able to be really efficient copiers until they're about in 4th and 5th grade. So if you're having trouble, if a child's having a lot of trouble copying in 2nd and 3rd grade, that's actually pretty normal. That's pretty normal. But what you can do to minimize that is you can make sure it's in the same plane. So if a kid is copying from horizontal to horizontal, that's a lot easier, or from vertical to vertical. So if you want to put them on a slat board, that's vertical. There are things that you can do visually, so the teacher can block in or highlight what they're copying. They can number what they're copying to make it easier. And then, of course, there's the question of how much, what is your goal? Is the goal for the kid to know the information, or is the goal for the kid to copy the information? And you really do want the kid to be able to eventually copy, because if you don't teach the kid to copy, and by the time they get to high school, if they don't have that skill, they may fall behind. So you do want them to do some copying, but the same way that we said that homework-wise, you can minimize the amount of homework, you can minimize the amount of copying. You can make the expectation that they'll copy down 5 lines, the teacher will copy down the rest, because you want to make sure they're not coming home with an empty worksheet. Sometimes you don't know why the child failed the test, and it may turn out because when they had this review sheet, it wasn't complete, and it was because of a copying issue. But if you don't get to the base of it, you may think the child didn't pay attention in class, or the child was a behavior issue on this, or whatever, you know. But if the source is really copying, then what you want to make sure is that they get the copying skills separately, and you can work on that sometimes outside of the actual classroom. And then you want to make sure they have the work. So those are two different
Thanks.
issues.
One of the biggest things that parents are doing, and I did it too, is this concept of spray and pray. Okay, we're gonna try a bunch of different things. Hopefully something will work, and we'll pray to God that it works. There's a big push today for research-based intervention, so I'm gonna ask each one of you within your field to discuss very quickly one research-based intervention so that we prevent spraying and praying. We actually do research-based interventions that target what the issue is. We'll start with Corey.
So I'll speak about vocabulary because that really is the basis, besides just emotional comfort and being able to focus. Vocabulary is really the tool, the vehicle for which we understand and express our language. So when we say best practice, they could be a strategy. So one of the strategies that we use for learning to read is, for instance, rhyming. And it's usually a fun activity, and it gives students an opportunity to recognize. In English, a lot of the sound and letter correspondence is really unfair. So often I'm telling my students, you made a very good mistake because of the example that they gave. If it was like kid, and it was the K-I, side, and they would say Sid, and where the short and long vowels, that vocabulary is very difficult to understand. But if they begin to look at the rhyme, and they say, oh, I know that I-D-E is always going to be I'd, then you begin to build the vocabulary a lot faster, because then you're just rotating in new letters in the front, and if they have the sounds to use, you blend them together, and all of a sudden they're using a lot more vocabulary. And so I'm using this with adolescents, I use this with younger kids. Doesn't matter the size of the vocabulary, they always feel confident going back to, I know what I can rhyme with this portion of the word, and that's a really important skill to have.
Okay. So when you talk about evidence-based practice, I did a lot of different therapy modalities, each which could take, I think, a lot longer than we have here. But I think a big piece of what we try to do before deciding what we use and how we use it is really kind of, when we touch about the assessment piece, especially in a school setting, being in touch with teachers, kind of getting evidence, not doing that kind of, you're talking about like spraying, just try anything. I think a big thing is first kind of finding out what's going on for the kid before you decide which, evidence-based practice and what tools you're going to use, and that can help prevent, I think a lot of that.
Okay, so there are a number of different modalities that I use depending on what the diagnosis and what we're working on. But I think the thing that's in common is is similar to what you were just saying, and that what I need to do when I'm looking at any child is I need to analyze what the issue is. So I remember that when I was back in school, one of our primary courses was a task analysis course, where we had to break down every motor skill into its component pieces, and those could be, the act of opening a can could be 20 steps. But being able to break it down, the importance of being able to break it down was that you looked at, how the child's hand was positioned, and how the child's torso was positioned, and how the particular can was positioned. And I think that no matter which setting I'm in, when I look at the child, I have to look at how the child approaches it, because there are many kids who can have poor handwriting, but one child has poor handwriting because he's holding the pencil incorrectly, and one child has poor handwriting because he really can't read and the letters don't mean anything to him and he can't, and another child has poor handwriting because of visual issues, and another child has poor handwriting. There are all different components that go into that, and I think that the things that OTs and other professionals do really well is break down the task before they try to approach it, so that they can address the issue.
Vivian?
Okay, coming from an academic point of view, I don't know if any of you or parents have read an ETR, which is a psychological report if a child was tested. And sometimes you'll go to a professional and they will come up with certain research-based ideas, and you would think it's God's gift to mankind because the psychologist said so, and especially if you went to a private psychologist and spent a lot of money, so you're going to be doing what they said. So I'm going to go along with what Ahuva said is you have to really look at the results of the testing. I'm going to name two research-based reading programs that we do at Tree of Knowledge. One is the Wilson Reading Program, or the Foundations for the Younger Kids, and those are for the children who do not have any phonological basis, and it's actually a fluency and decoding program. The other one that we use, which is research-based, is the visualizing, verbalizing program by Linda Moon Bell, and that is the opposite. It's a comprehension program. So you have two scenarios of two different children. If you have Susie, who could read but can't comprehend, we would use the visualizing verbalization program. If you have Jason, who he could comprehend when the material is read aloud to him, but the fact that he can't read and he cannot decode, and that's impacting his ability to access the regular ed curriculum, so then you would be doing a phonological based program, and it doesn't have to be the Wilson, it could be the STARS program. I mean, there are a slew of different research-based programs that you would decide. But we've had cases, and I've gotten paid for doing Wilson with kids that didn't need the Wilson. And I argue with the parents, this is not what the child needs. He could read. No, the psychologist said that the Wilson, because that is, everyone joins that particular bandwagon of therapy. So going again, as a parent and a professional, you should read that ETR and see where the breakdown is, and then do the task analysis, and then choose the right program that would fit for the child.
Okay, so we're gonna talk a little bit about the team approach, because obviously everybody today has financial constraints. You have a kid that's not doing well in school, and you gotta get a tutor, you gotta get an OT, and you gotta get some counseling in, and we only have a minimal amount of money, and it's always very difficult to get all the therapies in with the amount of money that you're getting. And the next issue is, so okay, I'll try to hire one tutor, I'll try to hire an OT out there, I'll try to hire a speech therapist. What's the benefit of having a team work with your child rather than hiring individual people that all work for individual places that don't communicate? Cory.
So, having a group, we all come with different lenses, and I think that's very important. We bring different ideas and different perspectives to a problem. There's also a tremendous amount of continuity. When you are just a single therapist, you don't know what's going on, you may not know what's going on at school, you may not know what's coming home for certain homework, you don't know what's maintenance, you don't know how they're generalizing things, but from a speech therapist standpoint, the generalization, I want to see that happening all the time. I'm not working just at a discrete level. If they're working at a skill with me at home, at school, but I know that the OT is working with them at the gym or at the playground, I'm interested in knowing about what is the language that's being used there. So that 360 approach is really quite valuable in generating interventions for myself going forward.
Go ahead.
Okay, so I was working in an outpatient setting where I kind of see kids one-on-one, and then also working in the school. I see a very big benefit. Very often when I'm working in the school, I'm working with a team that's right there, right in front of you, right available, and I get to see the kid in different setting, get to speak to the teachers, and I see a whole different approach to a kid than when I see them one-on-one, in an outpatient setting. And when I do that, when I see a kid in one outpatient setting, right away, I'll get permission from parents to speak to the school, to speak to any other therapist they have. It's a whole different world. You're getting to see the whole picture. And you're also getting to touch base with any other type of therapist they have or the school, so that whatever you're working on, they can generalize also in the other areas of their life. So I think in all areas, working in kind of that team approach and having that, and having that availability will help the student in every way.
Tahila?
Yeah, I agree. I think that all of those things are very valid. I also think that if you implement a particular strategy for a child, and all of the team members are using that same strategy with the child, so if there's a particular communication approach or certain words that you're using to cue, or certain motor skills that I'm emphasizing, if we can all do it consistently, it's to the benefit of the child. First of all, because consistency is always good, but second of all, because that way the child, in every therapy setting or in every setting that they have a team member who may not be a therapist, but whoever it is, they're getting that therapy multiplied that many more times. So so that's one of the benefits.
Yeah, I'm going to take it from a different tangent, that the team themselves have to work together, be willing. 6 years ago, I made history in Hillcrest Hospital because I fired the doctor that was in charge of my husband's case. He had a TBI, and they were interventionists, and they refused to act as a team with the other doctors, because I brought in my heart doctor, and I brought in his endocrinologist, and I brought in a different opinion for for pulmonologists and all that, and they thought I was crazy. They, when he had a fever, they said, okay, you're gonna bring in an infectious disease guy, and that's the way they talked to me. So first of all, if you don't talk to me nicely, forget it. So that was one of the reasons I fired them, but they were appalled. And when they asked me, afterwards, this is the first time that someone actually fired them, and I went to this chief of staff, and I said, will you take over this case? I want you to be the team leader, and I want everyone else who's going to come, because I brought in all the other doctors that I want, and I want you guys to work as a team. They were willing to do it. This group was not willing to do it, and hence, they wanted to know, where are you coming from? They were so annoyed with me, just as an aside. They said, you're making a grave mistake, and your husband's doing much better under our care, and if you do change the team, he may die. This is what, so all of a sudden, I flushed, am I making the right decision? My husband's a rabbi, so I had no one else to ask, I used to ask no one else my questions. So I said, I'll take my chances. And the team worked. So amongst ourselves, sometimes when you work with other people and you ask them to share, and what are you doing, and are you, let's work together. You ask the teacher, can I work with the teacher? That is very, very important, and the parent has to insist that the team of therapists work together. And I must say proudly that at Tree of Knowledge, we do that all the time. We call each other ad nauseum at any time, and everyone does, use that team approach.
Well, first of all, Vivian, I'm not going to mess with you if I ever have a problem. But second of all, there are two key things here that I was hearing today. And one is generalization, and that is 100% research-based. In other words, if we are just making a change in our office, and that change is not generalized over the entire day, we have not done our job. And so without having a team approach, the likelihood of generalization is very much reduced. That's one thing. And the second thing is, in terms of what Vivian was saying, in terms of a team, professionals sometimes also misbehave. You want good behaved professionals who also know how to work as a team. Because, going back to my original statement, social skills is something you want your child to be able to pick up. So if your team that's working with this child is not able to get along and work together, you're not going to get anywhere. And don't be afraid. I think one of the biggest things that parents have is, well, then this person will talk to this person and will talk to this person. The reality is, if you're dealing with professionals, they all want the best for your kids. And you want to be able to choose a team. And if you have an individual person who will not work as a team player, you are probably not doing your child a favor. Because today, it's getting complicated out there. And it's very, very important that we seek advice from other professionals to really benefit the child. Yay! A question from the audience.
No, I just wanted to add something.
Go ahead.
But the other thing is, if the professional is, so wonderful that he can work on his own, and, everything he says goes, there's no accountability. If you're working as a team, it's accountable to everybody. And
100%, which is
and
why
when you bounce when you say, well, this is what I'm thinking, the idea bounces back.
Right.
And
which is why you can't be afraid of it.
Right.
And also, you're modeling for your children. So many parents come in and they're afraid for the teacher to talk to the therapist, for the therapist to talk to the speech therapist. You're modeling fear-based education. And that's not what you want to be modeling. You want to be modeling that we are going to all work as a team to help you through this. Because then what you hope is that the generalization of that kid towards adulthood will then also work with the team, whether it's their work team or their family team, to create teams to help them. We all need help. We're always going to all need help. My favorite line is, if you think you're normal, you're not. If you think you're insane, right, you're probably normal. But if you think you're normal, you're probably insane. I definitely do not think I'm normal. So, but I might be still insane. But go ahead.
At what point do you think it's important to include the child as part of the team?
Oh,
I feel like
great
so
question.
many times we work so hard
Great
for the
question.
children and the parents and this, and the child's not included, and everyone set up this great program for the child, and they're just bouncing from one therapist to one teacher, but they have no clue to how hard we're all working. Like,
How important is it to talk to the child and to give the child choice? Start with you.
So it's individualized. You have to know the student, but I consistently try to engage the student to come to meetings because we live in a world of meetings. So how I'm looking at their social aspect. Can they come into a meeting without their iPhone? Can they actually make eye contact? Can they shake hands? Can they just add a sentence or two about why they're there? But then when I look at it therapeutically, I will take out the IEP and I will sit there with them and I say, well, let's review this. This is about you. This whole document is about you. And again, depending on the age and maturity level, we walk through, I don't go line by line, but I give them a brief opportunity and summary of what it is that we're doing. And this is based on some of the testing that we had done, and this was the information that as the team we collected, and this is what we thought would make the most sense right now developmentally. Some kids really like that. Some kids are out to lunch and don't want to hear it. But again, that's information also. It tells me the maturity level of my student and how am I going to motivate them. But if they are interested, it's really a great start.
Okay.
Okay, I think it's super important. I work with children, but I work a lot with teens. And this is their life and they want control, right? Every kid kind of wants control and knowing what they're doing, and you have a chance to empower this kid. They notice they have a struggle, or hopefully they notice. If not, we have to help them kind of. They're not going to want to do something unless they want to do it. So we have to kind of find a way to motivate them, let them kind of know, like, hey, this is something that we're seeing. Do they see it? Do they see a need to work on it? I just had a whole consultation with somebody for almost an hour about a student they were working with who had terrible organizational skills. And she had all these plans. I'm going to get her this. I'm going to get her that. I'm like, don't enable her. You're not doing anything. She's not going to learn the skill past that day or every single day that you check in with her. First, help her. Does she see a reason in doing what she's doing? Does she want to work on it? If not, we kind of might have to help her understand why it might be important. But I think it is super important for them to have a buy-in and have a say, hey, no, I don't want to do it this way. I think this way might be better. Kids are in tune, or hopefully, and again, this depends on the maturity level, but they kind of know some of the things that might work for them, and they definitely know some things that you might have in mind that won't work for them. Sometimes kind of a little bit of trial or error, like they might know, hey, maybe, okay, we can try this, but no, I am not willing to try that. So yeah, you kind of really have to have the kids weigh in on it, and it's empowering for them also. They're more likely to listen if they want to, or a lot more likely.
I agree. I think you covered it. I primarily work with younger children at this point, so although I agree with that, you have to motivate them. At this point, most of the kids that I work with are really too young to be full-fledged team members. For a lot of them, you don't want to point out necessarily. They know that they have difficulties. You don't want to necessarily label them at the age level that I'm working with. But for teens, I would definitely say they have to be on board. They have to understand they have an IEP. They have to understand why they have goals and what those goals are.
Can I just add something just to go back on that? It's not necessarily, I would say, labeling them, but just notice, like, hey, it seems like you're kind of struggling with this. You know, have you ever noticed that before? This is coming up. So not necessarily you have to give them their label of what it is and that they have this, but kind of helping them notice it in the areas that they're struggling. I think is kind of important. But again, also obviously depends on the age and how they're doing it.
Hey, our team mentioned theoretically how important it is, so I'll just give 2 suggestions for how-tos. One wonderful way of involving student is called student-led conferences. And I know that some of the schools have conferences tonight, and what I have done in the past was, as a whole class, when I taught in public school, the students would come to the conferences and be part of the conferences. And of course, we would prep them before. It's a wonderful, wonderful idea, because instead of the student is leading the conference, and therefore they can't even debate the grade because they saw the grade beforehand and all this was discussed. It's just wonderful. We even do student-led conferences when we do peer conferencing for portfolios. So we give them a set of questions, or they make up their own questions depending on the maturity level of the child, and they invite the parents, and they are the ones who are leading the conference and showing the parents their work. And a portfolio is a whole bunch of artifacts over a certain period of time. It could be over a year, it could be a unit, or whatever it is, and they actually take ownership. And then, again, since I'm a special ed teacher, inviting them to be part of the IEP and having them make the goals with you. I just spent an hour, right, where are you, Beth, with the student that we were doing it this week. We were going over the goals, and he was arguing, I do need this, I don't need this. We were debating, and we were talking about perspective, and this child lacks complete perspective. But we did compromise, and he took ownership, and he's going to be part of the IEP. On the downside, though, if you have a child who has no reality, I had a student today who was filling out a BASC, and when I looked at the BASC, it was diametrically opposite of the BASC that I filled out, because she filled everything that she was perfect. And the reason being is that she did not want the therapist to see what she's like. And she also asked the therapist, can she review the BASC with her mother, because she is going to determine what her mother is allowed to write on the BASC or not. So we have to temper the children's involvement up to a certain point, but there is a lot of
So
ways.
let's bring up the scenario that we hear every single day. My kid doesn't want to come. He's not happy going to the tutor. He's not happy going to the social worker. He's not happy going for speech therapist, right? Whether they're little and they're kicking and screaming and crying, or they're teenagers and they're throwing little fits. How important is it to insist?
Going first is a challenge. I'd like
Yeah.
to hear some other responses.
We'll
It-
rotate. That's a good idea.
I'm constantly talking to my students. My favorite phrase is, it depends. Nothing is black and white. And with my students that are on the spectrum, that have ASD, the context is really what's critical. Sometimes it's yes, sometimes it's no. An example I like to use is if you're walking across a busy street and you have the red sign come on and it's blinking, what do? And some people will say, well, you stop. Well, what if I'm halfway across the street? I don't think I want to stop right then and there. So expanding their horizons and understanding their problem solving, and there are different ways to look at things, is really important. So there are days that I feel like I need to let up depending on what they're dealing with and how well they can explain that to me. There's negotiation that happens. I look at things as a marathon and not a sprint, because if I don't have buy-in, if my students are not enjoying what they're doing, I'm not going to get much. They're not going to concentrate. They're not going to give me their all. And so sometimes there's more game playing. I mean, I have a student who I've worked with for literally 2 months, playing basketball, doing different sports, just to get rapport building before I've really gotten into a lot of more of the therapeutic stuff that I know is sometimes challenging. And I tell them, listen, I'm working on myself, and there are things that are told to me that I don't want to hear about it. But everybody goes through that, and we have to, and I try to do it in a gentle way, but reinforce and make them feel good about what we're doing and that they're successful. Making sure they have success. You don't want to end on failure. You want to make sure they start with something successful that they can do. You work through some of the harder things, and you review, and you make sure that they end on the positive.
Okay, great.
Okay. Great question. I think as a therapist and a counseling, it is one of the hardest things when a client comes in and they have absolutely no interest in being there, especially if you're dealing with teens. I think you kind of use the word depends. It really kind of depends how much is it impairing their functioning in a social setting, in a school setting, in the family setting. So just how kind of big is the problem that's going on, how much, and then you kind of go on talking to the child. Do they recognize any problem? Is there a way to kind of get their buy-in by noticing, hey, maybe this is a way of like, hey, you're not really happy with this. Is there a way that possibly going, can I kind of get to, what you want? Is this another way that, your siblings bother you all day long? Maybe this person can help you with some tools to get your siblings to listen to you more, or, trying to really kind of get their buy-in through talking to them. Not when they're overly emotional, not when they're really upset about things, but as far as like, hey, when do I force a kid when I see they really need it? Everything, it really kind of depends on how big the problem is and how much is it impairing their functioning. It is definitely hard when a kid really doesn't want to do something and when they're kind of forced coming in. Definitely when they're threatened to come in, that they're going to lose something if they don't come. There's a tremendous amount of anger that you have to try to break through to really help them. So it's kind of trying to really have their buy-in. We kind of got those conversations and seeing letting them know how this could be helpful for them. So yeah.
Okay, so I have a little bit of a different perspective. It's similar, but I think OT is a little bit different in that if your your child is complaining about coming to therapy and really doesn't want to go to therapy, but you feel it's a motor skill or something particularly, important that they need to learn, but sometimes kids resist things when they're hard. Sometimes kids will say, I'm so bored, and what they really mean is, this is so hard. Or, I don't want to do this because I don't feel successful. For a lot of the skills that we work on in OT, it's really important that the skills build, and if you don't work on them when they're young, later on you'll see much greater deficits. So if there, for some reason there isn't, rapport building is so important, if for some reason they're not connecting with their therapist, switch therapists. But don't, I do think therapy is important, obviously that's why I'm a therapist, so if you have a goal, and it's an important goal and the child really has a severe deficit, if the child's resisting therapy, find a therapist that will work with that child that the child agrees to.
Okay, I run a little red schoolhouse in my house where a lot of kids come, and sometimes I wonder, why do they want to come? It's so boring, and they do come. So I'm trying to figure out there's really no magic, but certain things work. Food, okay.
It really works. Edibles, we call it in the behavioral world.
Just practical,
Right.
rewards, giving them a safe space. It's very quiet, it's relaxing. I had one student says, I love coming to your house, and very resistant, coming for any other therapy. So I said, why? Oh, I just love coming because it's such a grandmotherly atmosphere. I go, I didn't like that answer. Who said I was there? I would say, oh, it's such a hip atmosphere. No, grandmother. Okay, that's what turned him on. Okay, so that's why he likes coming to the house. Sometimes I wonder. So it's just, there's no one reason how you're going to get them to come to your but you just try a little magic and your reinforcers.
So we've been around, we're getting about a 20-year perspective here, and we're always amazed at the revolving door. Kids come in and they say they don't want to come back. 2 years later, they mature and they want to come back. So I think and we talk about this all the time, the most important thing that we can do is provide that safe place for the child, even if they're not in a safe place. Because when they do register, and we have seen this over and over and over again, they will come back when they want to do that work. So one of the most important things that we can do is lay out what work we're doing with them, even if it's everything they don't want to do. But 5 years down the line, they may want to do it. And when they want to do it, they will remember your address. It's amazing how many times we have gotten students that came back, both in an academic world and also in a therapeutic world. So don't be afraid to lay out exactly what your plan is and what the skills are that they need to learn, even if at that moment they're not ready to accept it. We're going to take one question from the audience, then 2 more questions that people did not leave their names on, but if you want to admit who you are, then you'll get the gift certificate. Shira, what's your question?
Yeah, so I just want to add that in addition to providing a safe space for a lot of these students who may have been abused, may have had difficulty in school, and abuse can be subtle. It doesn't have to be that someone bopped them over the head with a baseball bat. It could be constant verbal put-downs, being told, oh, you're just not trying, when a kid clearly is trying and just is missing whatever skill. Even one person can make a difference to a child. So even if they feel like, oh, my school is in a safe place, and my home no one likes me, and this one doesn't like me, having one professional, one teacher, one therapist who is that safe place for them, who is that safe person, that can pull them back. That can kind of serve as, oh, I had that one person who I know was on my side. So I think that's something that we really try to provide here.
Shira, I'm gonna add something which is very shocking, because we've had this experience. Sometimes we are the taskmasters. We are not the safe place for that kid at that time. And that's okay also.
Sure.
As long as we are trying to help move that child, even if at that moment they are not ready to accept that help, they may register that this is the person that they need to go back to. So never take it personal when they say that they don't want to come, but make sure that they understand exactly what you do, because it may come back for later. So we're going to end with these 2 questions. I'm going to start with Vivian this time. How does a student's social skills impact his or her academic progress?
You should start.
I know, this was actually the question you should start with.
Okay, alrighty. Many times we think that a child has poor social skills, and I'm going to do it again with the academics. However, they can have what is called a nonverbal learning disability. And a nonverbal learning disability can manifest itself in many ways. They talk a lot, but they say very little. They see the trees and not the forest. Rick Lavoie talks about 4 paralinguistic deficits that these kids have. The first one is kinesics, and that means they cannot get the facial expressions of others. So if I don't have to say anything to you, but you can usually tell I'm upset if I frown, if I have a grimace, you can tell I'm happy if I smile. These kids don't get it. Another thing that they don't get is the proxemics. They don't know what is the appropriate boundary, how far you can stay away from someone. Another one is, and I'm sure you've had kids like that, you know, elbows away, right, whatever. Another one is the vocalics. They don't get the tone of voice. So if I raise my voice and I'm, you know, and I'm saying nice things, they can't even make the correlation between what I'm saying and the tone of voice. And this manifests itself that they don't get sarcasm, they don't get your jokes. They're considered to be airheads. The last thing, and it's interesting because being a fashionista, they don't know how to dress appropriately. We call that an artifactual deficit. They're the ones who are going to be wearing bell-bottom pants when it's out. I always remember the story of someone coming to interview for a job as a maid, and she was wearing a velvet dress. Now, would you hire a maid in a velvet dress? Absolutely not. You want the maid to be dressed appropriately. So all these you think are poor social skills, but they really are a deficit, some neurological deficit as well, and if we recognize them, and then we can address them. And then I'll bring it over to you to talk about the other social aspects.
So can you just repeat the question one more time?
Sure. How does the student's social skills impact his or her academic progress?
Okay. So, as I'm a parent, and listening to parents, that we often seem to focus, or in history, regarding academics and what are they doing academically. But really, the social piece is what develops first, and their ability to take perspective of other people, something called theory of mind, being able to understand how other people feel when it doesn't relate to me. When these skills are not developed, they reinforce a difficult time with academics. So whether you listen to from your students or you're a parent of obviously, and you're at a parent conference, you often may hear information about how my son or daughter is quiet, they're back offish, they don't comment, and a lot of it is because of their inability to read the room, to understand the right time to talk, how long to talk, who to talk to, when to talk louder, to talk quieter, to turn my chair the right way. There are all these little nuances that most of the time most developmentally typical children learn on their own. And sometimes we're not used to saying, well, we need to explicitly teach them how to shake a hand. And you want them to mirror the other person's hand. And we're going to combine our hands web to web. And it's not going to be a wet noodle unless somebody gives you a wet noodle. And all these things usually come as a surprise to parents because it usually just comes so naturally. And that's what sometimes is so difficult with these situations. But yeah, it naturally reinforces a deficit or difficulty
That's like the
with the
task.
academics.
That's like the task analysis.
Yeah.
That Tila was saying, but in
Right.
social.
Yeah.
And also, I was just thinking, do you think that if someone's not getting like let's say they're more shy or they're more scared and they have social issues, then they're less likely to ask a question in class to make sure they understood the work? Or no?
So there's a difference. There's a personality piece. Some kids are just more shy than others, but you still can teach the concepts of find that you're shy, but just understand that when you're this shy, look how the other people are reacting to you. The teacher doesn't call in, but I want to answer. We understand, but because you're constantly, not raising your voice or looking down when the teacher asks you a question, you're making it difficult for people to want to ask you questions. You're not attracting that type of response. I don't know if that answers your question.
Yeah, I want to add one other
Yeah.
thing that I forgot to mention. You mentioned success in school. There is something called the hidden curriculum. So we're not only talking about academic success. And children who have poor social skills sometimes don't get the hidden curriculum. They don't understand that freshmen, that seniors will go to the dance, and juniors will stand in front of the hall and make fun of the seniors going to the dance, but freshmen are not allowed into the dance. So they don't get that. What are the rules? In everyday life, even with handshaking, right? In Europe, you kiss on both sides of the cheek, right? In some places it's appropriate to shake hands, some places it's inappropriate to shake hands. Sometimes it's important to open up a gift. So in Japan, you should open up a gift, and in the United States, you don't open up a gift the minute you get the gift because that is improper socially. So yes, it impacts their ability to get the hidden curriculum in the school, and it impacts their ability sometimes to have friends, and it is so hard to make friendships, and kids that don't do well academically but are popular in school, you have those kids, they will succeed many a time more so than those children who are awkward socially.
I'm gonna wrap this up because we always wanna be able to do that, and I'm gonna ask each one of you to just give one small piece of hope. Because I know as a parent raising 3 kids, and now being a grandmother, I'm learning every single day, and I'm trying to figure out what it is, what can I do, and we talked a lot about research-based interventions and a lot about therapy, but like, what is the one message you can leave our parents with tonight that we can get through this?
Love them for where they are, and celebrate the small changes.
Go.
Okay, I think kind of a little alongside, the most important thing is your relationship with them, no matter what they're going through. If you know that, if they know and they feel strongly you love them, no matter what they go through, it's gonna help them get through it.
Tahila.
I think it's really important. Every child has something that they feel good about and that they can do well. Even if it's not academic, your kid might be the best hugger in the world, or might be, whatever it is. Help your child find that thing that he or she is good at, and help them feel really good about whatever it is that they can succeed in.
All right, and I'll just repeat what they said, our esteemed panel here. Celebrate their successes, not their failures.
And I will tell you, you're gonna get through this. You think you won't, but you will. You're gonna get through this. Kids grow up. They surprise you every day. And we here look forward to celebrating those successes. Thank you for joining us, both in present and online, and have a good evening. Join us for professional. So I don't know who asked these questions. Anybody want to admit?